We are asking actually China to be transparent, open, and cooperate.
The World Health Organization Secretary General Tedros Adhanom Ghebreyesus has called on the Chinese government to be open and transparent as the probe about the origin of COVID-19 continues. The WHO boss said investigations into the origin of COVID-19 in China are currently stalled by the lack of raw data on the earliest cases of coronavirus infections.
One of the challenges is access to raw data, especially the data, the start of the pandemic. The raw data was not shared. There was a premature push to, especially reduce one of the options, like the lab theory. As you know, I was a lab technician myself. I'm an immunologist, and I have worked in the lab. And lab accidents happen. It's common. I have seen it happening, and I myself had errors. So it can happen, and we need information, direct information on what the situation of these labs was before and at the start of the pandemic.
As the World Health Body concluded its first phase of investigation, which ended in February, the probe concluded that it was highly unlikely that the virus came from a laboratory in Wuhan, China, and that it probably originated in bats. China has called the theory that the virus may have escaped from a Wuhan laboratory absurd and said repeatedly that politicizing the issue will hamper investigations. Speaking in Geneva, Dr. Tedros said the WHO needed access to raw patient data from just before and the start of the pandemic this time around. He, however, noted that China did not share the data with the WHO team during the first investigation. Access to detailed information, he said, is among what the body needed to fight the pandemic. Speculation about a leak at the Wuhan Institute of Virology, one of China's top virus research labs, began last year and was propagated by former US President Donald Trump. In another development, the World Health Organization has raised concerns about the continent of Africa after the coronavirus-linked death surged by 43% in the space of a week, driven by lack of intensive care beds and oxygen.
I think we owe it to the millions who suffered and to the millions who died really to understand what happened. And I hope there will be better cooperation.